It's clear that vaccination is critical to fighting this pandemic. So while we all need to encourage uptake among younger adults, is the Minister in a position to guarantee sufficient supplies of Pfizer or Moderna vaccines to vaccinate them before the end of September? Whether legally, as in the case of care home staff, or through excluding people from social activities, does the Minister recognise that making vaccination mandatory can increase distrust among those who are hesitant and actually drive them to become outright vaccine refusers? Despite the talk about caution, COVID cases in England were already surging when the government ploughed ahead with lifting all legal restrictions on Monday. While vaccination has reduced the hospitalisation rate to between 2 and 3%, the Secretary of State himself suggested COVID cases could soar to 100,000 a day, which would result in 2,000 to 3,000 admissions, similar to the first wave. So does the Minister really not recognise that would put health services under enormous pressure and cause the patient backlog to grow further? Is the government even considering the impact of uncontrolled virus spread on vulnerable people, the incidence of long COVID, or the risk of generating yet another variant with even greater vaccine resistance than Delta? And finally, what contingencies are being put in place in case during recess the government need to reintroduce COVID restrictions, as has happened in Israel and the Netherlands?
Thank you very much, Mr. Speaker. The Honourable Lady makes a number of important points, especially her final point, reminding the House, as I did in my statement, that a number of countries have had to open up and then reverse some of their decisions, which is why we're being very careful to ensure that this transition to step 4 and then transitioning the virus from pandemic to endemic status is as successful as possible. She asked about children's vaccination. She will know because the Scottish Health Minister, Mr Humza, has, as the Welsh and Northern Irish, and of course ourselves in England, accepted the JCVI guidelines of vaccinating vulnerable children, children living with vulnerable adults, and those approaching their 18th birthday. And if the JCVI go further, as they are reviewing more data on vaccinating all children, then I assure her that we have the supply available of Pfizer and Moderna to undertake that, whilst we also continue to deliver on the double vaccinations of all adults by the end of September. She asked about the immunosuppressed. Of course, against guidelines have gone out in terms of the precautionary measures that immunosuppressed people would take, similar to the rest of the country, to be careful, to wear masks in crowded indoor spaces, of course, ventilation as well. And the JCVI has gone further in our interim advice from the JCVI for the booster campaign. They've placed the immunosuppressed at the top of the priority list for the boost campaign, which will begin early September. That is the operational target that we are working to begin boosting, and of course to co-administer wherever possible the flu vaccination.